Diving with Cancer by Dr. Gary Morris and Dr. Frans Cronje. Whether experienced or newly qualified, all divers who have been diagnosed with cancer do need to re-evaluate their fitness to dive. There are more than 200 types of cancers affecting 60 different organs in the body. The term cancer covers a wide range of medical conditions associated with abnormal and rapidly growing cells. Treatments for cancer vary both in type and effectiveness, although survival rates continue to improve through earlier diagnosis and more targeted treatments. A combination of increased awareness of early presentations, improved screening, and the rising average age of the diving population have led to an increase in the prevalence of cancer amongst divers. Sun exposure, HIV infection, smoking, and contemporary diets may also contribute to this increase. Not all abnormal growths are designated as cancers. Warts, moles, osteomata, which are the bony outgrowths in the external ear due to cold exposure, and skin tags are all abnormal growths, but because the growth is slow and orderly, the cells resemble normal tissue, and they don't invade or disrupt adjacent tissues. They are therefore called benign growths. Conversely, highly abnormal cells which grow fast, in disorderly fashion, and may spread or invade other parts of the body are called malignant. By convention, the term cancer is usually reserved for malignant growths, but it's not always strictly applied. Some technically benign growths may have harmful effects, such as those that may occur in closed spaces like the spinal cord or skull, where it's the confinement that causes the problem with compression effects. How may a diver be affected by cancer? Well, there are many ways in which a cancer may interfere with someone's health and their ability to dive safely. In general, diving fitness is determined by the diver's ability to withstand the physical rigors of diving and pressure changes, having the necessary coordination, dexterity, mental faculties and maturity to function in a potentially hostile environment, and also the ability to meet their civil or social obligations towards dive buddies, dive charters, and training organizations. As such, the following factors should be considered when evaluating a diver's ability to dive with a diagnosis of cancer. Does the site of the tumor compromise vital functions and tissues, or influence the way the person will adapt to change? Does the cancer affect the individual's physical and mental capacities to the extent that they could pose a danger to the diver or their buddies? Can the diver care for themselves or be able to assist others? Is it possible that diving can aggravate the disease, for example, increasing the chances of infection or bleeding? Can the treatment for cancer compromise the physical and mental capacities of the individual, such as causing a danger to themselves or others? And is there potential for sudden deterioration of the condition and an urgent need for treatment? There are various common sites for cancers, and each of them have potential effects on fitness to dive. Only some examples will be chosen for illustration purposes. Lung cancer. The lungs are subject to significant pressure changes in diving. As such, any tumor of the lungs can increase the chances of pressure damage or barotrauma by causing obstruction in the airways and distortion of tissues. This may cause uneven expansion of the lung and result in tearing or arterial gas embolism. Lung function itself may be compromised, making diving risky. Usually lung tumors are highly malignant and the disease progresses quickly, so the person soon becomes physically weak. A diver with any sort of lung cancer should have a thorough dive medical before considering further diving. Breast cancer. Breast cancers are common, and the DAN hotline receives numerous calls related to breast cancer and diving. The biggest issue is treatment and its side effects. Diving should not be undertaken before the surgical wounds have healed because of the risk of infection. Chemo and radiotherapy used to treat breast cancer can have toxic effects on the lungs and surrounding tissues, thereby compromising the lungs' function and flexibility. Some of the drugs used in the treatment of breast cancer may also be toxic to the heart and reduce physical reserves. They may also affect the nervous system and cause psychiatric side effects. Breast implants are not a significant problem as long as the surgical wounds have healed. A diving medical exam is strongly recommended for all individuals diagnosed with breast cancer, and this applies to both experienced and entry-level divers, irrespective of the duration, treatment, or status of the cancer. Intestinal cancers. Intestinal cancers are also fairly common, particularly colon cancer. These tumors and their treatment don't affect the cardiopulmonary system unless the cancer spreads to the lungs. The cancer requires removal of parts of the intestine, and sometimes a colostomy may be necessary, leaving the person with a stool-collecting bag attached to the opening of the stoma and wall of the abdomen. Diving is possible with such a bag, but care must be taken, particularly when kitting on and off. Pressure changes typically don't affect the intestines, so that's not a major consideration. Brain cancer. Any tumor inside the skull is problematic, whether it's malignant or benign. This is because it's a confined space, and tumor expansion will result in critical loss of function. The result may be loss of consciousness and drowning. The presence of a tumor may also increase the risk of bleeding. Several drugs used to treat brain cancer may cause altered consciousness or sedation. Neurological damage or loss of nerve function may also affect physical abilities. People with any sort of brain tumor are unlikely to be able to dive safely and should rather consider other, safer forms of recreation where loss of consciousness or sudden incapacitation is less likely to have dire consequences. Lymph and blood cancers. These cancers and their treatment usually affect the immune system, which means it increases the susceptibility for infection. Anemia, fainting, and compromised ability to clot or stop bleeding also causes potential side effects and may run the risk of additional injuries when diving. The opinion of a diving medical practitioner is strongly recommended. Skin cancers. Again, skin cancers are common and may particularly affect individuals with light skins who get into the sun a lot and have frequent episodes of sunburn. The most dangerous time of the day is between 11 and 3 o'clock, when the sun is at its brightest and the screening effect of the atmosphere is least effective. Sun protection should be applied at least 30 minutes before the exposure starts. There are 4 common skin cancers. The first is technically a precancerous lesion called solar keratosis, and it can usually be frozen off. The lowest grade skin cancers are basal cell cancers or rodent ulcers. They may become disfiguring, but they remain localized. Next, there are so-called squamous cell cancers that may spread to local lymph glands and require chemotherapy or radiotherapy. And lastly, there are the colored or pigmented cancers or melanomas. They are highly malignant and resistant to treatment. Plus, they regularly spread to internal organs like the brain and liver. Most develop from simple pigmented spots or moles. There are guidelines to warn people when to seek medical advice about moles in an effort to catch melanomas early so they may be treated more successfully. Early signs of melanoma include changes in the shape or color of the moles, or for nodular melanoma, a new lump appearing anywhere on the skin. Moles that undergo malignant transformation may be prone to itching, ulceration or bleeding. The warning signs can be summarized by the mnemonic A, B, C, D, E. A is for asymmetry. The mole is no longer round but has become oddly shaped. B is for borders. The borders around the mole have become irregular or scalloped. C. Color. The color of the mole is no longer a single shade of brown or black, but it has areas of significantly deeper or lighter color. Diameter. The mole is greater than 6 millimeters, about the size of a pencil eraser. And E. evolution over time. The mole changes its size over time. Nodular melanomas do not follow this progression, and therefore new lumps appearing with the following features should prompt immediate medical attention: elevated surfaces, firmness to the touch, and rapid growth. Note in particular that tumors of the face and lips may require extensive removal, which would result in disfiguration and therefore also cause problems with the fit of mask and regulator mouthpieces. Bone, liver and pancreas or kidney cancers. Usually cancers in these organs are extensive and debilitating. They result in fatigue, nausea, loss of weight, reduced energy, which makes it unlikely for individuals to pursue diving as a sport. The ability to dive would have to be assessed individually. Prostate and other genital cancers. These cancers do not pose a specific problem to diving, but the extent of treatment, wounds, and level of fitness may be affected. And then there's general well-being to consider. The emotional effects of the diagnosis and treatment of cancer can make a person feel hopeless and depressed. A cancer patient's physical strength can take a long time to recover after chemo or radiotherapy. There are many issues that stem from these, and all of them are extremely important to consider before diving. Apart from specific effects on the heart and lungs, chemotherapy has side effects like nausea and vomiting. The effect on the body in general can make a person feel weak or low in energy. Diving is not advised in these circumstances. When intravenous chemotherapy is administered over a long period of time, ports, access points, may be left under the skin. These ports themselves present no problems with diving. Exercise, cancer, and diving. The American Institute of Cancer states that staying fit, such as with diving, does help prevent cancer. Physical activity keeps blood pressure lower, increases bone density, regulates cholesterol, controls blood sugar, improves mood, increases brain function, and improves circulation. Because of these effects, physical abilities also help lower the chances of cancer, heart disease, stroke, osteoporosis, diabetes, depression, dementia, and arthritis. Moderate exercise during chemotherapy can be advantageous. Research by Dan America has shown a positive effect by continuing scuba diving after successful treatment of breast, prostate, and head and neck cancer. In closing, medical examination for fitness to dive after or with cancer. As mentioned previously, it's important to have an appropriate medical examination to assess fitness for dive with any cancer, whether treated or untreated, and irrespective of whether the treatment involves surgery, radiation, or chemotherapy. This applies whether you're starting diving or are already an experienced diver or dive leader. It is important that a dive doctor does the assessment, who has access to information and an accurate medical diagnosis. For more information, contact the DAN hotline or visit the DAN website on Diving with Cancer.